Hello, and thank you for your interest in the Rotary Action Group for Clubfoot. I'd like to tell you about the global problem of clubfoot, about the remedy for it, and how Rotarians can play a key role in improving the lives of thousands of children. This is what clubfoot looks like in various locations around the world. As it says here, clubfoot is the most common lower extremity birth defect globally, occurring in approximately 1 in every 750 births. That equals about 200,000 new cases each year, along with an unknown number of individuals who are currently living with this condition. In high-income countries, clubfoot is mostly a hidden disability, where you rarely see anyone walking around with their feet turned in and turned under like you see in these pictures. But in many low-resource environments, clubfoot is a well-known, very visible, disabling condition. Here are two examples of young people with untreated clubfoot, one in Nigeria and one in Brazil. It's not hard to imagine what it means to have to go through life with feet like these. There's great difficulty attending school, making a living, raising a family, or being a productive member of society. There's often significant stigma and abuse associated with clubfoot. Clubfoot happens everywhere. Estimates of the number of clubfoot cases in each country is based mostly on the size of the population and the birth rate. For example, large countries like China and India have tens of thousands of new cases of clubfoot every year. High-resource countries with lower birth rates have proportionately fewer. Although clubfoot appears as a foot deformity, it's not really a problem with the bones of the foot. Rather, it's a problem with several specific muscles, tendons, and ligaments that control the foot. As the foot is growing, sometime in the middle of pregnancy, these structures put on the brakes as other structures continue to grow. The result is the foot gets progressively twisted, as seen in the top left ultrasound picture. Understandably, parents and others want an explanation as to why their child was born with this unusual condition. Mothers often feel guilty that it is something they have done wrong. Other common explanations include a curse from one's ancestors, or the polio vaccine, or other similar factors like those listed here. It's none of these. It's an as yet poorly understood anomaly in the genes that affect development of the leg. It's nobody's fault. It just happens. Although surgery was the standard treatment for clubfoot for many years, it is not a satisfactory long-term solution for this deformity. Surgical correction requires extensive alteration to many of the joints, tendons, and ligaments in the foot, as well as the use of pins and wires to hold the bones in position. Long-term follow-up studies clearly show that individuals who underwent surgery for clubfoot as children, when they reach adulthood, they often have painful, stiff, arthritic feet and a very poor quality of life. What is now the gold standard non-surgical treatment for clubfoot was developed by Dr. Ignacio Ponseti at the University of Iowa and is known around the world today as the Ponseti Method. This method consists of a series of very precise, gentle manipulations, followed by application of a plaster cast to progressively return the foot to its normal shape and function. After a series of 4 to 6 manipulations and casts, changed weekly, clubfoot can be completely corrected. This time lapse shows the progressive improvement of a typical clubfoot over a 5-week period. Following correction, infants and young children then wear a clubfoot brace when they sleep up to age 4 to prevent return of the deformity. The brace consists of firm but comfortable shoes connected to a separator bar. The example shown here is distributed by Clubfoot Solutions, one of several non-profit organizations working to make high-quality clubfoot braces available to children everywhere. Maintaining the foot in the corrected position while sleeping is critical. The longer the brace is worn, the less likely is the chance that the deformity will return and the treatment will need to be repeated. Having effective, affordable, and available braces is a challenge in many regions around the world. Fortunately, the Ponseti method is very low tech and can be used everywhere in the world. It requires a skilled healthcare professional who can properly manipulate a sometimes very small foot and precisely apply a cast. It requires a supply of cast material, one of the least expensive medical supplies everywhere. It requires an effective, affordable brace to maintain the correction. And it requires the cooperation of the parents or caregivers to assure that the brace is reliably applied until the child is 4 years old and the treatment is completed. In 2015, a group of interested Rotarians obtained approval from Rotary International to form the Rotary Action Group for Clubfoot. As you see here, the rag for Clubfoot is similar to many other rags within Rotary, which focus on particular issues that are important to Rotarians around the world. The stated purpose of this rag is to mobilize Rotarians and provide global leadership to support timely Ponseti Method treatment and appropriate care for all children born with clubfoot. From the beginning, the Rag for Clubfoot has partnered with the Ponseti International Association at the University of Iowa, where the Ponseti Method was developed. The association has been the pioneer in promoting the non-surgical treatment of clubfoot around the globe, beginning in 2006. With 1.4 million members and 33,000 clubs in 200 countries, Rotarians are perfectly positioned to help free the children of the world from a life of disability due to clubfoot. Here are some actions that Rotarians can take. They can raise public awareness about clubfoot and reduce stigma. They can support training of healthcare professionals through global grants. They can assist clinics and families with logistical support such as transportation, housing, food, braces, and other needs to complete treatment. They can share information about Rotarians' efforts to support clubfoot treatment, including social media, websites, newsletters, meetings, conferences, and similar outlets. And they can advocate with governments and health officials to establish sustainable clubfoot treatment programs. In 2013, Rotarians associated with the Ponseti International Association and, soon after, with the Rag for Clubfoot, declared June 3rd as World Clubfoot Day. The idea was to promote greater awareness about clubfoot and to convey simple messages like clubfoot is nobody's fault, clubfoot is fixable, and where to go to seek treatment. As you can see from these pictures, groups in numerous countries have used this day to hold picnics, parades, parties, lectures, poster campaigns, conferences, and various media events. Rotarians in a number of places have helped with these activities. The foundation for correcting clubfoot is having a healthcare professional who can skillfully apply the Ponseti method. Although the process seems relatively simple, in practice it is not. There are various levels of training as shown here, but the most important training includes hands-on mentoring and hours of practicing the manipulations and casting under the supervision of a skilled trainer. That's where Rotary's global grants can make and have made a significant contribution to expanding the global capacity to treat clubfoot. Here's one illustration of why good training is so important. On the left is a typical case of clubfoot at birth. The middle picture shows one of this child's feet after treatment by a doctor who thought he knew how to apply the Ponseti method by watching videos on the internet. Thankfully, the treatment was taken over by a skilled treatment provider who was able to reshape the feet into a normal position. Rotary's involvement in helping correct clubfoot is far from new. In 1999, the Rotary Club of Barnaby in British Columbia and a club in Kampala, Uganda, received a global grant from the Rotary Foundation to train a group of orthopedic officers to correct clubfoot. This was the first demonstration that Dr. Ponseti's method could be successful in low-resource rural environments. Pictured here is the president of Rotary, Bill Boyd, visiting a clubfoot treatment facility in Uganda in 2006. More recently, the Rag for Clubfoot has helped facilitate a number of global grants from the Rotary Foundation to support the training of treatment providers. To date, these programs have been conducted mostly in Latin America. One example is the Vocational Training Team project in Colombia, begun in 2018. A needs assessment determined that there are approximately 800 children born with clubfoot each year in Colombia, with an unknown number of previously uncorrected individuals living with clubfoot. Based on the Ponseti International Association's 15 years of experience in other countries, it was estimated that at least 28 treatment providers were needed in Colombia. It was proposed that it would take 24 months for the training at a total cost of about $106,000. Support for this project came from the clubs you see here, their respective districts, and the Rotary Foundation. The principal organizers of the training program are seen in the upper left picture. Dr. Astrid Medina, a Rotarian and orthopedic surgeon in Colombia, and Dr. Jose Marquende, a Rotarian, orthopedic surgeon, and director of the Ponseti International Association at the University of Iowa. On the bottom left, you see Dr. Marquende at one of the training sessions. On the right, Dr. Erica Irana, one of the trainers from Mexico, is answering questions from the participants in the training program. And here is the traditional group pictures of the principal Rotarians involved in organizing and supporting this project in Colombia. This table shows the impact and return on investment for several of the RAG facilitated training projects. Note the results of the project in Colombia, underlined in red. 30 orthopedists were trained at a per capita cost of $3,500. Experience indicates that a well-trained practitioner of the Ponseti method will likely treat 50 patients each year, that is, one new patient each week. If each provider practices for 20 years, he or she will change the lives of 1,000 individuals. The 30 treatment providers trained by this grant are projected to treat 30,000 patients in the next 20 years, leading to a training cost of $3.53 for each life changed. A remarkable return on investment. Where treatment providers are available, Rotarians can help in a number of ways, as we mentioned earlier. For example, the Rotarian magazine in March of 2017 contained a short description of a project in Nigeria as part of the magazine's World Roundup. A close look at this article indicates that 3 clubs in Lagos, Nigeria, pooled their resources to support the treatment of 210 children with clubfoot. It's safe to assume that this money was spent for plaster, braces, transportation, food, and other costs of completing treatment using the Ponseti method. Coincidentally, one of the major organizers of the Nigerian Clubfoot program is a physician trained by Dr. Ponseti and Dr. Marquende in Iowa. Here is a before and after comparison of what it means to correct clubfoot. On the right, you see this little guy with his corrected feet very soon after coming out of his last cast. He obviously is not walking perfectly yet. He will need to develop strength in muscles that he hardly used before. Note that he is wearing a new school uniform now that he can attend school with his siblings for the first time. And here is our young man from Brazil after correction of his 2 club feet. Note the smile on his face. He can now look forward to a much different future thanks to the treatment he has received using the Ponseti method, even at 10 years of age. There will be 2 million children born with clubfoot in the next 10 years. Achieving a world free of clubfoot-related disability will require at least 4,000 trained treatment providers strategically placed in treatment centers around the world. Healthcare facilities and parents in many locations, especially in low-resource and rural areas, will need significant local support which Rotarians are ideally positioned to help provide. To find out more about Clubfoot and how Rotarians can help eliminate clubfoot disability, consider becoming a member of ragforclubfoot.org. Thanks for taking the time to watch this presentation, and please contact the Rag for Clubfoot if you have any questions. Thank you.